We're talking about kids and teeth this morning.
Kids and teeth.
Kids and teeth. So the most important part is, especially when you have a little baby, to start off on the right foot.
Absolutely.
They have no teeth. How do you take care of no teeth?
Good question. First thing is have the great attitude about teeth and about dental health. That's the most important thing you do is have the best attitude. And so actually it starts before the child's even born. And we recommend taking fluoride. I gave my wife fluoride when she was pregnant because the baby teeth are still starting to form, and the fluoride goes through the placenta barrier and actually helps build the teeth and help them be stronger.
Really?
Yeah.
So especially if your family has a history of soft teeth or poor teeth.
Anybody.
Anybody.
Yeah, anybody. Everybody.
And just go to your local dentist, your regular dentist.
Exactly. And fluoride is one of the cheapest things. There's absolutely no fluoride in the water up in Amador County, but we'll talk more about that in a minute.
Okay.
Okay. So how does that work with children that have no teeth? Their first tooth gets in about what age?
Oh, about 6 months.
6 months or so, right? So if they're a little early, no big deal. If a little late, no big deal. My kids were late. Okay. So getting them started right actually, my wife, we fed our children vegetables first and not fruits. So
they actually recommend that.
Yeah, if you don't give them the taste for sugar,
then they never develop it as strongly.
Exactly. So that's one of the first things to do.
Definitely. So now, what about brushing them if they've got little teeth or their gums or? You've got this funny little toothbrush on your finger.
Hey. I can draw a little face. This is actually a little tooth where you could put it on your finger. Yeah, it's like that.
Like that.
And
you see those little bristles on there?
And you could. This is a really good thing for infants up till they bite you. As soon as they bite you, time to use a big toothbrush.
A big toothbrush. Don't go for the small one. The biggest you could find.
So would you like some sugar in your coffee?
A lump would be great. Thank you.
Okay, here let me give you a lump on your coffee there. Okay.
So now we've got our baby. The teeth are starting to come in, and you're using our little brush, giving them the fluoride drops at that point.
Actually,
they can't
right.
Do the tablets at that
age.
And then what?
Well, then, again, talking to your child about seeing the dentist, I would actually bring your child with you to the dental office, okay, when you have your regular checkups, okay?
Bring them and let them sit on your lap while they're...
Exactly, and we have a lot of fun with the kids. We bring them in, we have them squirt mom with the air and water syringe, we show them.
That can be a little messy.
Yeah, and when they're actually 3 years old, we actually have them dental assist with us, and so they're having a good time.
That's great.
In fact, we just did that last week, and this one kid says, I want to be a dental assistant,
Oh, that's great.
So, and then we'll gradually build them up to where they want to be a dentist,
That's so good because at that age they're so curious. And how often do they get to stare into a mouth and see all those teeth?
It's a new experience.
That's pretty cool.
Yeah. So, anyway.
So have a good attitude. Make sure you use that fluoride. And how long should they be taking fluoride for?
Oh, good question. We recommend starting, in utero and going all the way to maybe 15. Now, a lot of dentists say, when the permanent teeth come in, you can stop doing fluoride. I recommend it all the way through maybe teenage years, okay? Because there is some additional benefits of fluoride that is not well known. So.
Oh, that's really good. Now, so we're doing our fluoride. Now, if we're using toothpaste and our kids are swallowing the toothpaste, we probably should not cut that.
Yeah, so there's fluoride in toothpaste, okay? And so, you brought up a good point with all of that. If you're swallowing the toothpaste, you're getting enough fluoride. But as soon as they stop swallowing the fluoride, like what you had mentioned with your child, okay, then they're not getting fluoride.
So start back with the fluoride treatments.
Yeah, and so actually, and then we're going to throw something else into the mix here. We're recommending not using toothpaste, okay? So talk to me about that.
And that was really interesting. We had a really good conversation about why do we use toothpaste?
Right. Would you like some more? Would you like another lump of sugar?
Let
me just give it to you anyway. Okay. That's two
thanks.
now, right?
That's two.
So you should really like that in there.
Yeah, I do like my sugar.
Okay. Okay.
Okay. So toothpaste, you've got you take it because it makes your teeth.
I'm gonna give you another lump. Is that okay?
Not really. But all right.
That's three now.
That's three.
I'm sorry.
Kind of toothpaste. We take it because it makes our mouth feel cleaner and fresh. Right. It's got the abrasive in there, which actually we found out is not needed. It actually causes damage.
Right. Some people really are really aggressive, and so they just wear their teeth. So we see them a little bit older, like my age, not your age, of course, but my age, and they're really wearing their teeth. So
the toothpaste actually adds to wearing down the enamel on the teeth.
Exactly.
The fluoride in there only really lasts for, especially if you're spitting it out, 5 minutes, 10 minutes?
Yeah, not very much. The little bit of fluoride here it's not that effective because there's a little protein layer that collects over the teeth, and the fluoride just is not that effective. Now, when you come to the dental office and they polish that protein layer off, that plaque layer off, then they put fluoride directly on the teeth. That's a lot more effective.
That's good. Well, we are running out of time, so I better
hurry. Oh, wow.
So I have not been brushing my teeth for the last week and a half with toothpaste.
Hey, would you like another lump of sugar?
Sure.
Here, let me give you another one.
How
many is that already?
This will be 5, I think.
This will be 5 here?
That'll be 5.
Okay. Oh, you want another lump of sugar?
6.
6.
It's not even dissolving anymore.
Yeah. Well, that's how much sugar is in 1 can of Coke. Okay.
Wow. And I just drank that in a cup of coffee.
Yeah.
Well, we're going to have you back to talk about more
We haven't even
dental.
gotten started yet here.
No, there's so much to do. So don't forget to come back and watch us Monday mornings on TSPN. And we are going over to Richard now.